guys, it's Naveed from Health Wellness. Today we are discussing Alzheimer's disease. As the big shows, it's the normal and Alzheimer's pain are totally different from the common man. Now move forward please. Basically Alzheimer is a type of dementia that causes problems with memory, thinking and behavior. Symptoms usually develop slowly and get worse over the time, becoming severe enough to interfere with the daily tasks. So, as you know about the definition, Alzheimer is a type of dementia, mean a person cannot focus on something. Alzheimer is the most common form of the dementia, a general term for memory loss and other intellectual abilities serious enough to interfere with the daily life. Alzheimer's disease accounts for 60 to 80% of the dementia cases. It's a hallmark of the dementia. It's a lot more percentage, 60 to 80% of the dementia cases are being forwarded to Alzheimer's disease. I briefly introduce you Alzheimer's disease. Alzheimer's disease is a degenerative brain disorder of unknown etiology, which is the most common form of the dementia. Usually start in the middle age and in old ages, result in progressive memory loss, impaired thinking, disorientation, and change in the personality and mood. There is a degeneration of the brain neurons, especially in the cerebral cortex, and the presence of the neurofibrillary tangles and plaques containing beta-amyloid cells. As I introduced Alzheimer's is a disease, a chronic, irreversible disease that affects the cells of the brain and cause impairment of the intellectual functioning. So guys, what do you understand? This is first discovered by the Alois Alzheimer, a German psychiatrist or a physician. Describes symptoms plus pathology, neural loss, plaques and tangles. As you see in the form, normal neurons are totally different from the Alzheimer's. As I zoom this picture for you, normal neurons are totally smooth and fine edges, and Alzheimer's neurofibrillary tangles are shown in the figure. As you see, amyloid plaques cause many difficulties for the neurons. Guys, I am showing you these pictures for normal and common understanding, as we are a common person and feeling difficulties to understand about the Alzheimer's patients. So I am figuring some common aspects of the Alzheimer's patients. Comparison of the normal age brain left side on the left side and Alzheimer's patient on the right side. You can see the difference. There are many points. Cerebral cortex of the normal brain is very healthy, but in Alzheimer's, extremely shrinkage of the cerebral cortex happens. How to recognize the early symptoms of the Alzheimer's disease? Many people thought many things and they are unable to differentiate between the Alzheimer's disease and a common person's behavior. As you saw in the picture, the first step is watch for the memory loss, one of the first signs of the disease. If someone has trouble recalling where they parked their car or what they went to get in the pantry, that is not usual and may be a normal part of aging. The loss associated with the early ages also. The other sign, the second sign, you can say, listen carefully. The inability of thinking of the word for common items like a spoon or a hairbrush may also occur. Maybe some people thought about what is the pen actually. They are different. They didn't distinguish between the pen, hairbrush, or and a different kind of common household items. This is not the same as being at the momentary loss of the descriptive words for something. Actually, he is forget everything, and he listens carefully for which words and trying to understand what are we saying. The third sign is paying attention. Difficult learning new things and making new memories is another indicator. People have very short attention span. Maximum they are repeatedly asked questions and the same question they ask many times. The fourth sign is spending time in observing things. being unable to perform simple everyday tasks as effortlessly as they once did. In is another symptom of the mild Alzheimer's. The individual may take longer doing routine things and become agitated if rushed. The fifth sign, beware of the behavioral changes. One of the earliest changes might be a loss of interest in the life or things also enjoyed. Once we enjoyed the many things, but after Alzheimer's disease, we are reluctant to them. Less energy, a lack of spontaneity, we cannot respond very quickly. We late in our responses. Emotional outburst. Suddenly we rushed and you can say, we anger on someone and unprovoked hostility and other symptoms. Now we are moving on the stages of the Alzheimer's. Stage 1 is normal, mentally healthy person. The second stage is normal age forgetfulness. Persons over the age of the 65 years experience subjective complaints of the cognitive and functional difficulties. Stage 3 shows mild cognitive impairment. The capacity to perform executive functions also became compromised. Commonly for the persons who are still working, job performance may decline. The other stages are the stage 4, the mild Alzheimer's disease. The most common functioning deficit in these patients is a decreased ability to manage instrumental activities of the daily life. Ability to manage finances and to prepare meals for the guests. The stage 5, moderate Alzheimer's disease. This is manifest in a decrement in the ability to choose proper clothing to wear for the weather conditions or for the daily circumstances occasions. Now on the stage 6, moderately severe Alzheimer's disease. At this stage, the ability to perform basic activities of the daily life become compromised. You can even move or walk freely. Now on the stage 7, severe Alzheimer's disease. At this stage, Alzheimer's disease patients require continuous assistance with the basic activities of the life for survival. Now the diagnosis of the patient. Detailed patient history. Almost every medical history and psychiatric history. Information from the family and friends. They can tell you what their habits are and what are their behavior changes. Laboratory test likes rule out vitamin B12 and folate deficiency. Nowadays, a new test called a biobarcode assay, which may be able to identify a certain protein in the spinal fluid associated with the disease, is being studied to determine its usefulness in the early detection of the disease. Hopefully, this will prove to be a key tool in diagnosis and treatment in the near future. Until then, be aware of the early symptoms of the Alzheimer's as we discussed it in earlier part of the video. The best way to catch it in its early stages. Treatment. There is no cure for the Alzheimer's disease. Primary goals of the therapy are improving symptomatic decline by improving cognitive functions, daily activities and behavior. The current therapy for the Alzheimer's disease. The others are arrest the neurodegenerative molecular process. Research needed. For Alzheimer's patient, the do-it-yourself approach, diet control, use of the exercise, stress control and herbal remedies are very beneficial. The medicines that approved for Alzheimer's disease and its symptoms are given below. Aricept, doramecin, used to delay or slow symptoms of the Alzheimer's disease. Used for the mild, moderate and severe Alzheimer's disease. Celexa, citalopram, used to reduce depression and anxiety. May take 4 to 6 weeks to work. Nimenda, we found memantine, used to delay or slow symptoms of Alzheimer's disease. Basically, it improves some memory. Razadine, galantamine, used to prevent or slow symptoms of the Alzheimer's disease. As has the same effects as Abontaining. Losses its effect over time, used for the mild to moderate Alzheimer's disease. Here are some pictures for inspiration. These are the people which are severely facing Alzheimer's disease. The Tom Pierce, he is a footballer and a coach also. Betty Schwartz, she was an event runner winner, a gold medalist in event running. The next person is Bill Quackenbush. He was a hockey player. And last one, the Ronald Reagan. As you all know that he is the 40th US President. Hope you enjoyed the video. Please like and comment and subscribe us, as we are providing you information in the further videos.